People, welcome to the chat. This is the evening talk and long time she could have gone. That is 6 hours of vibes that digging up upon the tune. Upon the tune of Benjamin the wise guy. Benjamin the wise guy, the guy who laughs every time. So I had a request to discuss something called hydrocephalus. What is hydrocephalus? Hydrocephalus is a condition in which there is abnormal accumulation of cerebrospinal fluid. But right about now, listen to this. Monday, a good day when we discuss, let me put that on flight mode so that someone cannot hit me up. Let's talk about hydrocephalus. But right about now, big tune, Ahmed DG. Ahmed, how are you doing? Which side are you tuning at? Welcome to the platform. The platform is called Benjamin the Wise Guy, and me, I'm Dr. Ben. Dr. Ben bringing you hydrocephalus, medical talks on top. Listen to this tune, guys. Listen to this big tune. Jamaican uncle, welcome to the top. Listen. Long time she could have gone. Welcome to my channel. If you are a new person, remember to subscribe, hit the like button, and also come to the chat. Tell me where you are watching me from. Are you watching me from Africa, United States, Asia? Are you watching me from where you are? Double tap your screen and say that you like them content. New guys, this is Dr. Ben, and we want to discuss about hydrocephalus. So big up everyone, big up every person that is watching, big up every person that is tuning in this, because here the things we do here are things youth band, she holding on. Long time she could have gone. So what is hydrocephalus? Hydrocephalus is a condition whereby fluids accumulate in your brain, and when fluids accumulate in your brain, your big head Anela, big up yourself for that $2 where it has come from it. So Anela, subscribe to this channel, meet them, make an uncle, meet some people that are coming inside. Big up yourself, and if you have any big tune you want me to play, let me do. Long time she could have gone. That's the sweet sound of Vibe Cartel hitting upon Benjamin the Wise Guy channel. So today is a good day that we want to discuss something called hydrocephalus. And don't confuse me as a DJ. I'm a doctor. I'm a doctor. The love for music has taken it all over. So music plus learning is equals to fun and some education. If you are new to the channel, tell me where you're watching from. Tell me where you are seeing Dr. Ben from. Tell me where you are relaxing and watching and feeling the tune for. So let's welcome everyone. Big up Jamaican uncle. Let's listen to the tune. Listen to this tune. Abo! The tune is called Hold On. We don't just get someone and then things come up and then you say, no, let me get out of this relationship. This tune is called Hold On. Listen to this. If you are a new person to the channel, this is the time you need to subscribe. Hit that subscription button. Hit the like button. Let's come to the chat. Tell me where you're watching me from. But right about now, let me give it gasolina. Instala gasolina.
She could have gone. We go through this time and a 2 youth band. She's holding on.
It's called She's Holding On. Right about now, what we are going to talk about. Hey, the new guys that you're coming and watching me, don't confuse me as a DJ. This is love for music, but this person here, Dr. Ben, in Benjamin the Wise Guy channel, is a doctor. So today we want to discuss a topic called hydrocephalus, water in the brain. Hydrocephalus is a condition in which there is abnormal accumulation of cerebrospinal fluid within the ventricles of the brain, causing ventricular enlargement, increasing pressure on the brain tissue. Let me get something. Your brain is. Let me draw something for you. So welcome if you are a new person. Tell me, Dr. Ben, I'm watching you right about here, and I'm watching you right about America, US, every place, So your brain is here, and then this brain has them. So this is your brain, my friend. This is your brain. Stan's Kitchen. I want to discuss something called hydrocephalus. So the brain ventricles, they have another, but let me welcome Stan's Kitchen with the tune of the day. Stan's Kitchen!
Long time she could have gone. We go through this time.
If you have a channel, don't try this at home. I usually tell people, don't try this at home. If you have a channel, don't try what Dr. Ben is doing, because you will get the strikes. We call them Viboko 18. Viboko 18, you will get the strike. So I'm drawing a brain here, and this brain has now look. No, the cerebral. Ben, you are funny. I said. Asante sana my brother. Welcome. Asante sana pia wewe. Belina said hi. How is Belina? This is Benjamin the Wise Guy. This channel is called Benjamin the Wise Guy, and this is Dr. Ben. I'm not a DJ. I just love music. As we learn, so hydrocephalus, cerebrospinal fluid, the fluid that cushions your brain, surrounds this brain like this. But you get some people have a lot of cerebrospinal fluid, and it accumulates and it becomes so much so that this brain bigs up and it expands. The brain expands like this. Look at here. Belina, welcome to the channel. I don't know where you are watching from. Please tell us where you are watching from. So the pressure becomes bigger and then the brain expands like this. You see, this is called hydrocephalus. The space beyond the normal. So let me check. Belina is here. Benjamin, good life. Benjamin, yes, I love good life. So Benjamin, this is Belina. subscribe to this channel, and that is called Hydrocephalus. Listen to the tune of the day. Yeah, hold on, listen. You don't just come to this channel and you run away. You hold on and get the message. Listen to the message.
We go through this time and I do you bad. She holding on.
She's holding on to this every time. Now, the term hydro means water. You know, hydrocephalus. Cephalus means the brain. Hydro means water. So it means directly that you have water in your brain. Very fine, you see. Hydrocephalus, water in your brain. Just imagine this. Normal CSF pathophysiology, when you have accumulation of water in your brain, what happens? Your brain becomes bigger. This is accumulation of brain in water. Now, this is what happens. If you are watching my friend Beauty in the house, beautiful always.
Yeah. Long time she could have gone.
Beauty. It's a Monday and I'm feeling I'm okay. Beauty. Yes. Beauty, welcome to the channel. Welcome to the channel, my friend. If you are watching Benjamin the Wise Guy, there is no instance of feeling bored. Here we come and we feel smiles and we smile. And I can see Lizmu Official. Lizmu Official, welcome to the platform. Thanks for tuning in to Benjamin the Wise Guy channel, and thanks for watching. Thanks for watching Dr. Benjamin. I'm talking about excess accumulation of water in your brain. It is called hydrocephalus. Hydrocephalus only means, hello host and the chat, Lizmu, welcome. Hydrocephalus only means water in the brain. And I know some of you have always heard about water in the brain. Some people have always heard about water in the brain. Big up Beauty, big up Lizmo Official, big up Belina in the Kistan's Kitchen, Jamaican uncle. I can see I have a new friend called Arnel from San Francisco. Arnel from San Francisco today has told me that you are talking too much and I'm feeling good. Take $2, go buy something to drink, and I'm drinking what? I'm drinking this green tea, which is removing antioxidants in my body. So nice. Good. Green tea removes antioxidants. I can see Famino, long time Famino. Let me give you this tune and feel good. Listen where you are seated. Don't stand and dance. Just shake your head and your neck.
Yeah. Long time she could have gone. We go through this time and I do you bad. She holding on.
She's holding on. I like seeing my friends here. I like seeing my friends feeling good. I like seeing my friends popping up and saying, Benjamin the Wise Guy, we are feeling nice. On Monday is a great day. When you are starting the week. But to some people, it's a very hard day. But welcome everyone. Welcome Beauty. Welcome Belina. Welcome Lizmu. Welcome Official. Another friend of mine has just popped in. He's called Dild. I don't know how to sound that name, but Dild, I can hear that pull up selector. We are talking about hydrocephalus, water in the brain. Famino, welcome Famino. You've gone so long. You've gone so long. When you go so long and then the doctor misses you, you miss a friend. A friend is missing you. I'm a friend of everyone and I like smiling for everyone. So for me, DLIHDF. Please give me a name to call you, man. Give me a name to call you, Belina, tell Diddles to give me a name to call him. So today, right about now, we want to discuss something that is called hydrocephalus, water in the brain. Initially, it was this, but now it is this. Your brain is cushioned in the skull with some fluid that rotates to the spinal cord, so that it cannot do what? It cannot get to hit the skull and then it gets destroyed. But the fluid, cerebrospinal fluid, becomes so much at times, and we want to know why it becomes so much. Belina, get the tune. Don't stand and dance because we are in car. Yes, I watch FIFA. Give me a name to call you. Don't stand and dance. Where you are seated, just enjoy the song and tune up your head like this. And leave me a like. If you have not subscribed to this channel, please subscribe to this channel, man. This is a good place. This is a good home. Many good friends. Kamdake. My sister from United Gong is in the house. Leila, big up. You are my true sister, man. You are my true sister. You are a cool girl, a true one, a lady with the dignity and the integrity. And I want to give you the hold on tune and say,
She could have gone, we go through this time and a 2 youth band. She holding on.
Hey, she hold me on. Now, this is hydrocephalus. This one, accumulation of water in your brain. So, normal production of CSF, the fluid that is in your brain. CSF is mainly produced from something that is called carotid plexus in the brain. You see, between, located in the ventricles, between. The brain is 1, 2, 3, 4. And so the water is produced inside. It is about 500 ml. 500 ml. 500 ml is a lot of water. Just imagine your brain produces 500 ml. Let me show you what 500 ml contains. Now, look at this, my friends. This is what 500 this is called normal saline. And this one is 500 ml. 500. So your brain produces this daily. This one, just imagine. Total CSF volume in adults is about approximately 150 ml. So daily your brain produces a lot of water. Just this amount. So it flows from the lateral ventricles like this, foramen, third ventricle, and then there is a place called cerebral aqueduct, foramen lusca, subarachnoid space inside, and arachnoid granulation and venous circulation. So it surrounds, it produced as it surrounds. It's not just stored somewhere. But why do people have hydrocephalus, big heads with big brains? And what is the function of the fluid that the brain produces? 1, protects the brain from injury, provides buoyancy. The brain is balancing so that it cannot be hurt. Removes metabolic waste. The waste that, your brain removes some things inside. So it removes the waste, maintains chemical stability, and transports nutrients. Even your brain needs oxygen and glucose and, and nutrients so that it can survive. So this fluid produced, it circulates inside. So what happens? What happens, my friend? But the tune of the day today.
Long time.
It's called, the tune of the day today is called Hold On. And I can see new friends in the house and they are smiling, saying that this doctor of ours, this doctor turned DJ. Man, learning while you are enjoying is a good thing. Learning while you are enjoying is a good thing. I can see my sister Leila tuned in the house. Belina, which country are you coming from? Are you from Kenya here? Here, Kenya. You know, Kenya is it's like the capital city of Africa. So, Belinda, are you in Kenya or where? Eh? Where are you, Belinda? I can see beauty. I can see everyone is beautiful. I can see Lizmo has a channel, my friends, and Lizmo, you go to the channel and do something. You go to Leila's channel, see how he's cooking good mandazis. I don't know mandazi in English, but I know it's a dough that you can, if cooked with meat, and then you feel nice. You go to these channels and watch them. You see, if you have a channel, leave your link here. Let's follow. But I'm telling you, Leila has a good channel, and everyone who is having a good channel, follow them. But right about now, we want to talk about something that is called what? Hydrocephalus. The fluid that is produced in your brain helps to protect your brain from injury, provides buoyancy, removes metabolic waste, maintains chemical stability, and transports nutrients. Your brain needs oxygen. Your brain needs nutrients to survive. So the fluid carries, and just like the blood does, the cerebrospinal fluid does it too. So how does this condition called hydrocephalus, big head with more water in the brain, come on? Hydrocephalus develops where there is an imbalance between production, circulation, and absorption. So Leila, let me tell you this, Leila, hydrocephalus is not a big term. It just means water in the brain. It means water inside your brain. Hydrocephalus, water in the brain. So it's not a big term. Someone asked me to talk about hydrocephalus, and today I want to talk about it. As I finish, you see, if you have any medical question, ask, bring it. If you are a new person to the channel, let's see where you are watching from. Let's hear you where you are watching from. You see, so let's talk about what's the problem in hydrocephalus. Your brain, you have seen kids with big heads, are born with big heads. Maybe their brains are producing more than 500 ml per day. The circulation may be blocked, or absorption inside the brain and removal is a problem. So obstruction of the flow. There is a place called aqueductal stenosis. Aqueductal is the place that the fluid goes in, becomes stenosed, becomes small. Brain tumor is something like a growth, so it can block the way. It can block the way of it. A cyst. A cyst is accumulation of water inside a pouch. Congenital malformation of the brain that people are born with can bring a problem. So this leads to accumulation of cerebrospinal fluids inside the brain and obstruction, ventricle enlargement. You know, if fluid is being produced and there is no drainage, the ventricles, the brain ventricles will enlarge. So that you have seen some people with brains that the head since childhood have come like this. So the fluid pushes the ventricles into enlarge. And then the pressure inside becomes big. You know, when you are producing fluid and the drainage is small, the drainage of the fluid, it is not enough to make the head to be, so you become, the pressure goes up, cerebrospinal fluid, and those people who have hydrocephalus, they have tendencies of headaches. Why? Because the 12 cranial nerves are being pushed inside. So impairment CSF absorbing as you remove, can be a problem. So people that have meningitis can have this problem. Bleeding inside your brain and the clot blocks the places of drainage can have this problem. Inflammatory diseases of the brain. Inflammation, I said, is swelling, redness, hotness, can make your brain to block. So I've always said, don't slap your kids in the head. Don't, when you are mad, you want to discipline your kid, please don't slap your kid in the head. You can block it, and this kid may start to have the accumulation, and it's not good. So let's get other ways of disciplining our kids and not slapping our kids, mostly in the temporal regions. Why? Because in the temporal regions we have carotid arteries, and there is trigeminal nerve that comes like this, and this trigeminal nerve is cranial nerve number 5 from the brain. So when you slap your kid, you are hitting the trigeminal nerve here. This is called ophthalmic. It comes and then it branches here 3 times. Ophthalmic, maxillary, and mandibular. Hey, Fiona, my lawyer, how are you doing, Fiona? Let me give you this as the tune of the day. Fiona.
Long time she could have gone.
Fiona, welcome to the talk. So we stop slapping our kids at the temporal region, because the nerve, mandibular, maxillary, and ophthalmic that branches from here, you are hitting it, and this child may start having chronic headaches, and you may do what? You may make the brain to have injuries, whereby the drainage of the cerebrospinal fluid may be impaired. When it is impaired, you start having hydrocephalus. Blockage can come up with tumor growth. So let's stop slapping our kids in the head and get a new measure of disciplining. So absorption can be a problem. Subarachnoid absorption, inflammation, disease, and meningitis. You know, meningitis is called a disease of the meninges of the brain. Inflammation. CSF accumulates through the ventricles and it's not drained. Excess CSF production. You can get someone is producing like 3 times this. The brain produces this 3 times. And the main place of drainage is still, and absorption is this, still the same. There is something called choroid plexus papilloma. You see, that makes you to produce, the cells of your brains are producing, my friend, let me talk slowly. If you are not understanding anything, or I'm going too fast, talk to me. Tell me, Doc Buan. Doc, my friend, Doc, you are talking too much. Fast and we are not getting it. So there is a tumor from the brain called choroid plexus papilloma. It's a tumor that blocks the absorption. Thanks for the knowledge, Mr. Benjamin. And Fiona is our lawyer student from Uganda. A very humble lady, my friends. A lady with integrity and dignity. The parents have brought up Fiona in a good way. Go to Fiona's channel and check out Fiona. Advise our lady, because she's the lawyer in the making. And Fiona, I like how humble you live and how honest you are. And how, my guys, my people, if you are watching me, please don't, go watch Fiona too. Fiona is a good lady with integrity, and culture that is perfected as an African woman with respect. You understand me? Still a student lawyer. So we were talking about hydrocephalus. Hydrocephalus, water in the brain. Eh? So choroid plexus can produce a lot of fluids, but blocking because it's a tumor. Effects on the brain. What can hydrocephalus do in the brain? If you have a question, don't fail to ask, my friends. Ask your question. Let's get to understand these things. Let's get to understand, because so many people are you get children, and then after 1 year they start having brain tumors or complications. You wonder, why is my daughter, my son having a big brain? You go to a hospital, you are being told he has hydrocephalus. Compression of brain tissues. Effects of hydrocephalus. Increased intracranial pressure, causing a child or an adult to have headaches, vomiting, and papilledema. Edema only means swelling. Reduced cerebrospinal flow. So some of your brain areas will not receive oxygen and nutrients because of blockage. We have types of hydrocephalus, my friends: non-communicating and communicating hydrocephalus, congenital hydrocephalus, acquired hydrocephalus. Acquired is where you have head injury, tumor, stroke, or infections like meningitis. But congenital hydrocephalus, those ones are people born with. You are born with it. When you are born, you have something like accidental stenosis in your brain. So you have seen children born with brains like this. This one is called congenital. So the aqueductal stenosis, the one that drains, is small. And neural tube defects. I explained about neural tube defects. Please, if you don't understand, ask me. Intrauterine infection. So women, if you are pregnant and you are giving us a good one, a good life, life is coming. Hey, a child is a blessing. Please take care of sanitation. Take care of sanitation. Why? Because if you have chronic infections, mostly STDs, sexual transmitted disease like gonorrhea, syphilis, it can go to the child, and then the brain of the child can have problems, blockage of the drainage of and then you will give birth to a child with hydrocephalus, with a big head. And you are the problem. Your sanitation was not good, and when you got an infection, you never went to a doctor to get medication. Take care. You see, very important. You see, you understand now. Now you are feeling the vibe. Hey, you are feeling the medical vibe. If you have a question, come to the chat. Let me get the question. Let's discuss the question. So, congenital hydrocephalus, cytomegalovirus, toxoplasmosis, those are bacteria that are bad. We don't want our women when they are pregnant to have these things. Bad, totally bad. Communicating hydrocephalus, CSF flows from ventricle, but absorption is impaired. Now, I will go just juju. In Kenya, we call juju. Juju means partial. Non-communicating hydrocephalus is another one. But the most problem of hydrocephalus is congenital and acquired. Life with the Russells. Big up, life with the Russells. Let me give you this big tune of today. Hey, please stop it.
Long time she could have gone. We go through this time and not too youth back. She holding on.
Life with the Russells, welcome to the chat. Welcome to the chat, Life with the Russells. Getting it from the parent. Oh my God, yes, please move. You getting it from the parent, because the parent is not responsible Big up life with the Russells. We are talking about hydrocephalus, water in the brain. So the parent is not responsible enough to know that I have an infection, I need to go to the doctor to be treated. You are living, and you've seen some parents that when they are pregnant, they take alcohol, they get neural defects. Alcohol no good, smoking no good, infections no good when you are pregnant. That's why you go for clinics. You go for pre-clinics. That is congenital hydrocephalus, present at birth. Big heads because the cerebrospinal fluid is not being absorbed and it's not being drained well. You see that, my friends? You see? Or am I talking so faster? Come on, if I'm talking so faster, please tell me, my friends. I want these things to be understood. If you are watching me, the person who is talking is Dr. Ben, but the channel is called Benjamin the Wise Guy. So you have to you double tap your screen. And if you are new to this channel, don't forget to leave. You subscribe. You subscribe so that when Benjamin the Wise Guy is live, you get notification. Hey, this doctor that always smiles and loves dancing is here. Life in the Russells. Wow. Big up. I love music so much because it makes me calm and it makes me feel the vibe. You see, So when I'm teaching and we are communicating and we are indulging music in, we feel nice as we learn. You get it? We feel nice as we learn. So we have said what? Infections no good. First of all, when it comes to the second trimester, when the brain is developing, you remember how the brain develops? We have the sperm and the ova, they fuse. When they fuse, they are called the zygotes in the fallopian tube. They flow up to the walls of the uterus. So they form cells that are called a blastocyst. We have mesoderm, endoderm. You remember those cells? So the outside, they start coming in, forming something that is called the neural tube. The cells are, the blastocyst is like this. So we'll catch up later, Dr. Benjamin. Much love, sister. Much love to you too. So when they come in, they form neural tube, and this is the most complicated time. You are taking alcohol, you are smoking, you are not taking good nutrition, even no supplements. So the mesoderm, the endoderm, when they are coming in, some cells are left outside. So the brain structure does what? Deteriorates because of you. You who is not responsible enough to kick out infections when you have this problem. Big up, my friends. I'm liking it when we are discussing these things. And remember to tell your sisters, your brothers, your children who are studying medicine, and everyone, Dr. Ben is a smiling doctor. Come and see smiling doctor. Now, normal pressure hydrocephalus usually affects older adults. So even you, an adult, you can have this problem. You start having a big head. Despite enlargement of the ventricles, CSF pressure is often normal. Classic trial. You will start walking badly because you don't have balance. Urinary incontinence and cognitive decline. Most people that have dementia, the dementia, you understand dementia? Problems in the brain. They have what? This problem, pressure, hydrocephalus, because if it is not being taken absorbed, it means raised ICP. So, causes of hydrocephalus, as we continue, it is, at night we have short time. Yes, Kaskai, welcome, yes, Kaskai. If you have a question, ask, because when I'm finishing, I'm signing off. At night, we have short time. Now, it is 10:47 p.m. Here in Kenya. Imagine, and I've not gone home. So let me give you the knowledge, and then I sign off. I go home. Causes of hydrocephalus, congenital causes: acquired spinal bifida, meningeal, the Walker malformation. We will go one day about these things. Arnold Chiari malformation. Those are conditions that you are born with. Acquired causes: brain tumors, meningitis, tuberculosis, subarachnoid hemorrhage, intraventricular hemorrhage, and head trauma. Now, clinical features, how you see, or medical features, because cranial features are not fused. Symptoms: enlarged head, bulging fontanelles. Here, if you look at a child here, the fontanelle is bulging. Always crying, irritable, poor feeding, and vomiting. And then we have signs: scalp veins distension. You see the veins here are distended, even in the neck they are distended. Frontal bossing, sun-setting eyes, looking like this. We call them sun-setting eyes. Downward gaze. Yes, sun-setting eyes are looking like this. Imagine to a child. In older children, you will get nausea and vomiting, blurred vision, you cannot see well, drowsiness always, and seizures, because the brain is being compacted with a lot of fluid. Sometimes even the older children get coma. Brain herniation, you get a hernia in the brain. And what are the complications of this? Just imagine the complication. Your child may not have normal development milestones, disabilities in learning, vision loss, seizures, and death if untreated. Because if the brain is compressed after so long, it means death is just away from a corner. So that is how it is. We do very many things to get this is a hydrocephalus. What can we do in a hospital? We get the head circumference of a child, because if it is larger than the normal, we know there is a problem inside. We check at the fontanelles here and here. Are they bulging? If it is bulging, it means there is a lot of fluids in the brain. In adults, because the skull is hard, what do? We check the neurological examination. And what is the neurological examination? The 12 cranial nerves of your brain. Let's say them: olfactory, optic, oculomotor, eye, olfactory, optic, oculomotor, trochlear, trigemina, facial abducens, and then we have glossopharyngeal, we have spinal accessory, we have the vagus nerve, we have there is one that I'm forgetting. Which is this one? I want to name them so that people can know. We have 12 cranial nerves from the we have 12 cranial nerves arising from your head: olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, the facial one. And then we have vestibulocochlear, glossopharyngeal, vagus, cranial nerve number 10, accessory, and hypoglossal. So the one that I was forgetting is facial nerve, cranial nerve number 7. You see, that innervates a third of your tongue, 2/3 of your tongue. It is called number 7. If that facial nerve fails, you will never feel anything. Even if you eat, taste will not be there. So we are continuing. Neurological, we examine. How do we examine to know that this person has hydrocephalus? Smell, are you feeling it? Optic, are you seeing? Oculomotor, are your eyes moving? Trochlear, moves down. Are your eyes moving downwards? Trigemina, facial sensation. and muscle of mastication, because trigemina has 3 branches. So this one is for facial expression. This one is for sensation, and mastication is mandibular. Trigemina innervates 3 things. Oh, Muriet! Hello, Doc, and everyone. Muriet, this is a talk that we are bringing. Welcome to. Welcome, Muriet. That tune is for you. Now, that is how we examine if the skull is being compressed, because the cranial nerves arise from your brain. If there is something that is not working, we'll know with the nerve. We were continuing. Abducens, eye movement, lateral. Your eyes are just popping up in one side. It means cranial nerve number 6 is not working. Facial. Are you able to smile? If I tell you, beauty smile, Lizmo, smile please, and you are not able to smile, we know there is a problem in your brain. Vestibulocochlear. If I call you, are you able to hear? Do you have balance while you are walking? Because vestibulocochlear nerve comes here and goes to your ears. It is making you you cute Jessie. Hey, now I can see you. Yes, glossopharyngeal. We said facial nerve innervates 2/3. The other 1/3 is innervated by glossopharyngeal, a third, and also swallowing. So thanks for the warm welcome. Come on, Muriet. So the other 1/3 is for glossopharyngeal, because facial gives taste from here to around here of the tongue, and then the swallowing, how is everything to everyone. The other one is for what? Glossopharyngeal. Vagus nerve. It is called vagus because it is going everywhere. Parasympathetic supply to the thoracic bone, everywhere in the abdomen, swallowing, and the way you are listening to me, it is because of the vagus nerve. Accessory. If your brain is injured, you cannot do this, because accessory nerve innervates trapezius muscles and sternocleidomastoid. So hypoglossal, tongue movement. So that is how we come and see that we examine, we see, are you able to, all those things that I've gone through, we see now the brain of this person is being compressed, the nerves are not working, the intracranial pressure is high. You see, any question, my friends? Any question? But before
long time she could have gone. We go through this time and a 2 youth back. We are come from far, and we can't turn back star.
Hey, if it was not for music, I don't know where I could live. Maybe I could be in Mars, maybe I could be somewhere in Jupiter, so lonely, but because the world has music, I feel nice. I feel nice, and music, I always say, my friends, music is my alcohol. I don't drink alcohol, but when I feel music, I feel the vibe, and good news comes in. I tell you, wheel up and come again, selector. That comes from life in the last and release.
Remember
Yeah. We'll come again, selector. This is Dr. Ben and not a DJ. So, my friends, as we go on, this is what we can do. You know, we can do very many things here, and the time is getting out of hand. But no big deal. If you have a question, ask me. The other things we can do, what I was discussing was about examination of what has failed. But what we can discuss, the other thing we can discuss is cranial imaging. You can do cranial ultrasound to check if the brain is okay. You can do a CT scan, computed tomography to see and if the brain ventricles are enlarged or if there is an obstruction or tumors. Or we can do an MRI, magnetic resonance imaging, to see if there is the aquidal stenosis is there, or tumor is there, or congenital abnormalities. Now, treatment, we give some diuretics to remove the excess fluids, and and surgery is done. I don't like going mostly on the treatments, but when it comes to specific treatments, your doctor is the one to do what to say this is the treatment that you need. Now, that is hydrocephalus. I will discuss about specific hydrocephalus when time comes. Anyone with a question before I leave? Imagine it is 11 p.m. It is 11 p.m. Please, what you do, there is someone who is calling me, a patient is calling me. No, Anas will deal with that. Ask a question. Anyone with any question? How about prevention? Now, this is about prevention. Prevention means we avoid things can bring this thing up, right? Infections in pregnancy, we take care of them. Prevent neural tube defects. Take folic acid. Some women don't take folic acid because folic acid is the one at when the blastocyst, that ovum, has fused, yes? The good moment, the good feeling of a sperm meeting the egg, they implant in the uterus, they form something as cells that are there, they form something that is called the blastocyst. That is the time, the first trimester. Women, are you listening? You need folic acid there because it helps the development of the neural tube and the development of the egg. When the folic acid is moving, forming the neural tube, that is where you need this supplement. The DNA is being developed at that moment. So for you to avoid issues like the prevention of neural tube defects, take folic and iron at the first trimester. Very important. Women planning pregnancy should take folic acid before conception and during early pregnancy. Eat forage-rich foods and green leafy foods, bananas and fortified cereals. Attend regular antenatal clinic. Yes, that is from Lismo. That is prevention. Prevent maternal infection. Good hygiene. Avoid undercooked food and promiscuity. No promiscuity. No promiscuity. No. Men that are watching, if your woman is pregnant, don't go out until that boy, that child, that girl is born. Why? We don't want infection. Don't go out. No. Promiscuity. No. Seek prompt treatment for infection during pregnancy. Prompt treatment. Any sign of itchiness, doctor, I'm not feeling well. Very important. Ensure recommended vaccinations are up to date and avoid contact with feces during. Why? Because feces, poop. Avoid. Why? Because poop has got a very bad bacteria that is called toxoplasmosis, and it brings this problem. Avoid undercooked meal, Why? Liver flukes, hookworms. You understand? Hand hygiene, very important. You get that? Prevent meningitis. Meningitis can cause scarring of arachnoid villi and impair CSF absorption. We have talked about it. Vaccination against common causes of meningitis, be it viral or bacterial. Very important. Maintain good hygiene practices, early diagnosis and treatment of meningitis. Prevent head injuries. Stop slapping your kids when they are still young. Oh, I have known why pregnant women are given folic acid once they visit prenatal clinics. You see, Lisbu, you are smiling, feeling good while you are watching me, and we are getting knowledge. Yeah? We are getting knowledge. Yeah? Benjamin, the wise guy, Lisbu, tell your sister, tell your son, tell your child, tell your girl, the doctor, a funny doctor that gives us knowledge. Folic acid, very important. Prevent head injuries. For adults, children, helmets. Wear seat belts. Protective sports equipment. Follow workplace safety always. And hydrocephalus is not in kids alone. It comes to adults too. Early treatment of brain tumors is important. So if you have chronic headaches, you do what? Go seek attention. Do MRIs. Don't say it's always normal. No. You do what? You seek MRIs. You understand? So, let's continue, my friends. Let's continue. Prevent premature birth. Premature infants are risk on the interventricular hemorrhage, which can lead to. So, if you are pregnant and you have your man and you are bleeding towards giving birth, take bed rest. Go see the doctor, take bed rest. We don't want premature bleeding. You see, we don't want premature bleeding and premature birth. Very important. You understand these things that I'm saying? They are life-saving situations. I may say them in a funny way, but they are very important. Prevent premature birth, good antenatal care, control maternal illness, avoid. Let me repeat, my friends. Please let me repeat this, and I'm saying them in capital letters. You see, now I'm not smiling. When you are pregnant, avoid smoking, avoid alcohol, avoid harmful drugs during pregnancy. Before you take an antibiotic, go ask your doctor. Even antibiotics may be toxic to you when you're pregnant. See a doctor before antibiotics. Don't take over-the-counter medications when you're pregnant. Please don't take an over-the-counter, because that is not a doctor who is prescribing. Go to a doctor. Even the pharmacist will not give you. If you tell the pharmacist I'm pregnant with first time later, no, go come with a prescription. Early detection should be treated. So those are ways to prevent them. Our new friend, Lismo official. That is the way to prevent. So Muriet, my husband has an issue of itching after birth. My husband has an issue of itching after birth. Hey, let me understand that after you give birth, or your husband has an issue after birth. Oh, after which birth? Muriet, please let me understand. Hey, that one is coming on, so it's hitting me in a different way. My husband has an issue of itching after birth. Oh, hey, that one was giving me. Yes, after shower, go. That is normal to sometimes because when T3 and T4 have an imbalance, it can make you feel like itchiness. Release of histamines after change of weather, or of temperature, instant change of temperature. It can make you feel like itchiness. But if it is persistent and it's bringing some goosebumps and some rashes, you can go do the regulatory thing. What regulates temperature? Thyroid. Go and do thyroid function to see which one has an imbalance. But if he is a person who has thyroid complication, you clearly understand it may be T3 imbalance. Which foods have folic acid? Green leafy foods. Hey! Cute Jesse, you know you are cute. You are confusing some people. You little sister, confusion of some people, and you are cute yourself. So smile always, and God will bless you. So cute Jesse, take leafy foods, green leafy foods. They'll give you folic. But when you are pregnant, cute Jesse, are you pregnant right now? As we speak, are you pregnant? I know you are not pregnant. I know you are not. So when you'll be pregnant, go to the clinic, antenatal clinic, and take folic acid. When you want to get a kid next month, start. When you want to get a kid next month, Lismo is laughing at cute Jesse. Start taking folic acid this month, and take green leafy foods a lot. So, my friends, I think I've answered most of our questions, and it is 1 hour. It is 1 hour. I like joking with my little sister, cute Jessie. So, where you are, I know, beauty where you are, it's at night. Where beauty is, maybe it's around 12 or 1 hour behind, or 9. In Kenya, it's 12 p.m. Those who are in Kenya are watching me at night. Those who are in Jamaica are watching me at midday, I think. And those who are in the US are watching me at midday, like Jamaican uncle and everyone. So, my friends, any question before I sign out? Any question before I sign out? Cute Jessie, being pregnant is good. So if you are not, I know you are planning one day. Yes. So hey, Dr. Steno, yes, I said 1 hour behind Kenya. Beauty is 1 hour behind us. So the last question before I sign out. Any last question before I sign out, my friends? Any question? Okay, nice, my friends. And that's why when washing now, ladies are supposed to start from the front going back, even wiping. Cute Jessie, you are very right. When you are washing your vagina, don't say meow. Say it. This is medical. Wash from washing, ladies. When you are washing down there, wash from the front going behind. Because if you are pregnant, and when you are pregnant, you know the vagina is kind of like open. So more dirt can get in, and more bacteria are susceptible because it is open and moist, and more glucose is there. So toxoplasmosis from the other side can get in. So take good care of it when wiping. That is a very important message from cute Jessie there. That is a very important message. So my friends, I have to drive home. I have to go home. It is 11 p.m. Where you are, Be blessed. May God be with you. Let's meet tomorrow to continue with our topic of the day. Bye bye. See you tomorrow. Remember to share. Remember to like and tell the people to subscribe. Yes. Bye.